Welcome to Safe Spaces, the podcast brought to you by Women's Health in Women's Hands Community Health Center. Join us as we delve into crucial conversations about gender-based violence, featuring survivors, advocates, and community members to raise awareness and offer insights on this crucial issue affecting our communities. We are your hosts, Leslie
and Tommy Lola. Safe Spaces is presented by the GBV Prevention and Cure Cascade Program, supported by funding from Women and Gender Equality Canada. Tune in to this podcast series, available on all major podcast platforms and our website, flourishaccess.ca.
Please be aware that this podcast covers sensitive topics such as domestic abuse and gender-based violence. To protect the privacy and safety of our guests, some have chosen to remain anonymous. The content of this podcast is suitable for those aged 16 plus.
A study by Statistics Canada in 2020 showed that 10% of Canadian women reported experiencing violence from a partner during the pandemic, with rates even higher for marginalized groups such as Indigenous women and women with disabilities. Canadian Women's Shelter reported significant increases in calls for help, with some experiencing 20 to 30% spike in demand for services. Today on the Safe Spaces podcast, we'll be delving into the impacts of gender-based violence during the pandemic, the disproportionate effects on marginalized communities, and the urgent need for systemic change. We'll also explore how service providers and communities have adapted to support survivors in these unprecedented times. Stay with us as we speak with experts and advocates working on the front line of this crisis. I want to welcome our episode guest, Chantal. Please introduce yourself to our listeners.
Thank you so much. My name is Chantal Mukandoli. I am HIV positive woman for 30 years. I come from Africa. My country is Rwanda. I've been in Canada for 18 years. I'm a mother of 4. I have 5 children. And my expertise in the community is to work with women. Also, I'm an advocate, activist in HIV and AIDS programs. So now, currently, I work here at Women Health in Women's Hands Community Center in HIV Health Services Navigation. Thank you.
Thank you for that introduction, Chantal. Hi, everyone. Again, my name is Anna. I'm the gender-based violence case manager at Women's Health in Women's Hands. So today we're going to go right into our first question, and that is, what are the main forms of GBV that emerge or intensify during crisis?
Yeah, so for me, if I understand from my experiences, I choose one main form for GBV as a raped culture. So I'll explain about that. If you see is emerging during crisis, because as a women, African women, be married in families, they take advantage of that women to be a woman of a family. This means there is not respect. They put that women, degradations for that women, to put that women inferior without any word. So is that one, because, and then that woman don't have a word to say, don't have a right to fight for herself. So is that where I talk about this main form, and that I choose to talk about it today because it happened. And then one thing just I want to do and to say it today, I wanted to break silence of what is happening in SCB community women. And that's where some of the women get infections as HIV, hepatitis B, or STI. So is that the crisis I want to talk about today?
Thank you for that, Chantal. And for all our listeners, I also wanted to touch on in terms of also for domestic violence, especially during the pandemic that we just had, domestic violence spiked as victims felt more confined. So being in the field of GBV myself, the first thing I thought about during the pandemic was everyone is at home. And for some people, home is not actually their safe space. Being able to go to work, being able to go to the gym, being able to go to a senior center, being able to go to a mom and me class, being able to go to an after school program, because gender-based violence is not unanimous to a specific age. It can happen to anybody. So even being able to go to an after school program or daycare or to go to school, which could have been elementary or high school, were people's safe space. And that's somewhere that you get to go to for 8 hours at minimum. So that is a lot of time where you at least got to for 8 hours in the day. As small as that may, as small as that may seem for individuals that have the privilege, because that's a privilege we carry to always feel safe all the time. Someone just having 8 hours, 2 hours, 1 hour, because maybe you were stay at home, but the person that was doing the abuse went to work.
Yes.
But now they're home all the time.
Yeah.
And even we have to think after the pandemic, for some individuals, hybrid or working remote, again, is a privilege. You're excited for it. But for some people, that means their abuser is home with them all the time or more often now.
Yes, yeah.
So even that creates that unsafety again. And then you have the emotional and psychological abuse.
Yes.
Like in the UK, a woman reported that her partner constantly monitored her online interactions, phone calls, all during the pandemic, further isolating her from friends and family, but also heightening her dependency on them. Because at that point, you no longer have anyone else. And that's a big part of GBV.
Yes.
In the power and control is isolating you from the individuals that were your support system or your trusted circle, so that you now feel you have to depend on them, because to you now in that situation, you're looking at the life I thought I was going to have before is no longer. So let me accept this new reality. And then you have things like sexual violence and exploitation. And this was really the financial hardship part of COVID and also the pandemic, because we're also talking about times of crisis.
Yes.
Right now the economy is not doing well, but that may be for now, again, a privilege some people face, where now maybe where you're feeling it, where some people have been feeling it for years, where an example of that for financial hardship and sexual exploitation in GBV would be cases where people were coerced into sexual survival. So basically providing sexual favors in exchange for essential goods like a rent reduction or being able to have food. Or it could have also, again, positions of power. It could have been maybe in the workplace to have extra shifts. So it's going to look different for everybody based on where they are. So it was a lot, especially GBV that emerged. So there was a lot of different forms, from domestic violence, emotional and psychological abuse, sexual violence and exploitation, and then you had the economic abuse as well.
Yeah.
Because a lot of people, even in COVID, like a lot of people lost their jobs. That in itself was chaotic, because in some cases, not being able to provide for your family, the frustration that comes with that. And then in some cases, the partners of these people, they become bitter and, like it becomes a really bad thing. So people are trapped in their homes. They can't escape the trauma.
Yes.
Yep.
Yeah.
The overall.
That's why I have that experience. If I say that it happened here during a COVID, that crisis. Think about this woman who cannot even talk inside in a house, to take it like object, family object. So she don't have even any power to say, I want to divorce. I want to go out, because this person is a newcomer, is a family who come here, and then she don't know even anywhere to go. She don't know even anywhere to ask services. She don't have even any friends, neighbors, but she's inside in a crisis of COVID-19. So I know some of situation like this. So that's why I bring this in the crisis of COVID-19, what has happened. Raped culturally, stay in a house with your father-in-law, sleep with you because cannot go out, a cousin, because this woman was married with elder brother, so younger brother come to her, so she don't have nothing to do, she cannot even go out, cannot
There's
even, so things like that is psychologically, emotional, mentally, spiritually, even physically, for this happened.
Yeah.
That's so accurate. I wanted to ask as well, Chantal, how can we shift the narrative from GBV as an inevitable consequence of crisis to something preventable and addressable?
To achieve that, there is not any problem without a solution. Because for me, experiences of this, what we're doing, that is like educations. Talk about it. Break silence for people to know about it. Or to create some space, like this one, health space, safe space, for where some of the women have experiences for now. Even if we say COVID is gone, but people still have that scar. People still have that crisis mentally. But the most important is because we have some tools, we have some people come like you, like myself, to express, to share experiences, how we can end this. But for me, the most important is to prevent this and address this, is to find some people who is really have experiences of that, to share their storytellings in the front of other people, create a support group for some people who have experiences of this COVID-19 crisis and what has happened to them. I think that is to prevent some of things like this GBV consequence of a crisis.
Absolutely. I believe that the education of the people, that's where everything starts. Educating the people, ensuring that they know, they're able to identify early signs of GBV, helping them to understand that you don't have to do it alone. As you just said, break the silence, have the uncomfortable conversations. Having these conversations that build awareness are some of the ways that we can actually help to change the narrative. I know that one conversation won't do it for sure, but it takes a village, right? It really does. And if we all chime in and have something to say, then it gives the policymakers something to do. At some point, we will be heard. In order to change the narrative, we must focus on proactive measures and systemic changes. This involves recognizing that GBV is rooted in power imbalance and societal norms.
Yes.
It can be challenged and reformed through education, policy, and cultural shifts. Governments and organizations need to prioritize GBV prevention by ensuring that crisis response plans incorporate comprehensive support systems, including shelters, counseling, legal protections for survivors. Public awareness campaigns can also help to reshape how we view GBV and even helps us to understand that when people are going through crises and stuff, we ourselves, we can be a safe space for someone to have that conversation.
Yes, yeah.
We should always try to have like a non-judgmental approach, if someone comes to have a conversation, because in a lot of cases, people are not even as informed as, they could be. So sometimes you have some information too that you can pass on to a friend or a family member or someone who's experiencing GBV. And as you rightfully said, a crisis isn't always going to be in the form of a pandemic.
Yes.
You understand? Sometimes we have our own personal crises. We have a family crisis. We have things happening around us in our workspaces. So it really is that, we can have the conversations and hope that we are heard and changes are implemented.
So, education is the most important, and also to have some of the people is ready to share the experiences. It means people who already acceptance, that is the key for any circumstances. So if the person accepts how to, or let me say how to disclose, let me talk about disclosing. Disclose maybe what has happened, share experiences, fight a stigma discrimination, because a stigma, that is the fact, make people not to be able to share the experiences, to talk, just be quiet because they don't want people to reject them. That also is something make this crisis to be worse. Otherwise, tools, we can create tools, policy makers and everything, but have some people in a government, in the organizations, community members, peers, advocate, researcher, who is ready to fight stigma discrimination of GBV.
So you see, Chantal, how you said that just now? So remember how I was saying that we of ourselves, me and you and Diana and our friends, like we can be safe spaces for people.
Yes.
Because you see, when people come to have conversations, it's people like me and you who are not believing them, who are being judgmental, who are stigmatizing them. So definitely, and another thing you said about people being willing to share experiences, one of the things that I think is very important is that you see, if you've been through it, you know it, right?
Yes. Yeah.
And I think relaying that story comes with a level of passion and a level of this
acceptance.
Is my story. I'm accepting. This is my reality. And when those people, I think we need to have more survivors who are determined to be change makers, right? Because when that happens, that's when the story is more relatable.
Yes.
Right? So most certainly, like, I agree 100% with what you said.
Yes, most definitely I agree with individuals coming forward and being able to be that safe space by coming with that lived experience. But like you said, Leslie, it has to come from a place of passion.
Yeah.
And in order to do that for some people, they need to see some sort of change. And for Chantel, I've been in many rooms with you, and Chantel's definitely someone that walks with her story and conveys it in a way of passion and owns her story. So she advocates, and you advocate in every single room you go for by just telling your story. So creating more spaces where people feel comfortable in doing that. And like you said, the public awareness, like in the UK, they created a campaign, hashtag isolate abuse, which encouraged friends and families to remain vigilant and check in on loved ones during the lockdowns and pandemic. We also had, when TikTok and social media, especially during the pandemic, they had signs. If someone made a video and they showed a certain sign on the video, that means that they were in an abusive situation and that was a call for help.
Yes.
So even just having those small signs, whether it's, I'm not going to say any signs right now on the video, just because we're also viewing it to everybody. And how being a GBV worker, what I always think about is I don't want to give away a tool to someone that may be listening, that may be an abuser and now understands what that tool is.
Yeah.
And is able to recognize that. So online, you're able to find that. And then also the proactive policies. So during the pandemic, in some European countries, governments allocated specific funding for domestic violence shelters, specifically during the pandemic, to ensure they remained operational and could safely house survivors despite the lockdown. And then we also have in Canada organizations like WAGE, which is Women and Gender Equality Canada, and then also MCCSS, which is Ministry of Children and Community and Social Services, that provides funding for new projects and initiatives that support prevention, education, and support issues around gender-based violence. So it's also allocating more funding towards those. Because being in the GBV sector, there's one thing, yes, at times there's funding, but there's not a lot of long-term funding There will be
Yes.
funding maybe for 2 years, 3 years, but maybe after that, there's no one that's offering funding again for another 4 years. So then you've created supports, you've created programs, but now the funding has stopped and the support stopped as well in that time. So it's creating funding that is more reoccurring, just like police services are able to get millions every single year, and the health system gets millions, billions every single year.
Yes.
GBV should be looked at the same. It always needs to be funded. There should never be a project that is started or initiative that is started, and the reason why it has to stop and individuals have to lose a service that they've now trusted is because funding has stopped. So
Yes.
that is definitely something also to look into. And then accountability within the supports. Like
Yes.
in Argentina, emergency GBV hotlines saw 30% increase during the pandemic. And that's why recognizing the root cause and now public health experts coming forward and being able to say that, yes, while stress may cause heightened behaviors of abusive behavior, GBV still overall stems from the existing power imbalances and cultural norms. And it's addressing that root causes in addition to the policies, in addition to the funding, and then creating those safe spaces for individuals to come forward, share their stories, but also have allies that are going to be also able to be beside them for when, as much as you've maybe gone through it and you've been a survivor now, you know, maybe no longer identify as a victim. Telling that story multiple times sometimes can be hard. And then that's where the allies can come in and also be the ones that also assist in being a third party to share a story when someone is unable to do it themselves that has allowed their story to be shared. So also being a support system for those individuals that were asking to come out and share their story. Also letting them know that you still have support with being a support for other individuals.
Thank you for sharing that, Zayana.
Most definitely. So I did want to ask you, Chantel, how do crises impact access to support services for GBV survivors?
Yeah, so like I said before, I think the impact is how to know what is going on there in terms of, I will give, for example, or an example. In COVID-19, there was a group of women aging, living with HIV, and they need, for example, to go to see the doctor for appointment or to get some treatment or checkup. But it was a little bit difficult because of that crisis to get services. If you see that is also psychologically, like you said, psychologically abuse. You are inside the house. You cannot go out. You have a right to go out, but because of a crisis, you cannot access support. You cannot access services. So for me, for this one, it makes me to feel like to have stress, depression, even to go trauma.
I definitely hear what you're saying, Chantel, in terms of the strain / lack of availability to services. So especially during the pandemic, and a really big one example I'll pull from is actually the shelter system.
Yes.
So people having access to shelters, because again, everything was 6 feet apart. And again, with everyone being able to maybe watching those that had your own home during the pandemic, maybe you weren't taking into consideration always the 6 feet because maybe everyone in your home was tested and that was fine. But within the shelter system, 6 feet had to take place. And I'll use it in terms of the squares. So those tiles that are usually on the big squared ones in the shelters before the pandemic, in respites in Canada are considered places that can house chronically homeless individuals. They're usually co-ed, have a section for male identified individuals, female and female identified individuals, and then also couples. And how the beds pre-pandemic were spread apart because they were cots were 2 squares. After the pandemic, it was needed to be 6 feet apart. So say a shelter that could hold 200 people, now during the pandemic was only allowed to have maybe 100 people because of the pandemic. Washroom access within those places. And then also looking at one thing, GBV that is experienced by individuals that are transient, so do not have a permanent place of residency, or they're homeless. Those individuals also going to a shelter and not being able to get a bed somewhere.
Yeah.
Being even in an abusive situation in your home and then wanting to reach out to a shelter, but all the beds are full. And it's mainly due to the limited number of individuals that they're now able to take. So that was even a huge strain. People wanting to access supports, but not being able to access supports because the number that you're able to serve decreased or the places shut down. And then even post-pandemic, right now, I guess we can say, a lot of services haven't completely reopened because, again, what the pandemic created was a lot of jobs that are now hybrid and remote that were also in those social service and support service fields.
Yes.
So even though you may be in a shelter, there's shelters where now a counselor may only come on site once a month.
Yeah.
And you don't have those services. There's some shelters that had spaces that were communal and post-pandemic have still not been able to fully open back those spaces because now you have a lot more positions that are remote and hybrid. So you don't have those numbers within the facilities to be able to say, okay, we can have everyone in this communal spaces, or we have all these additional supports, but they're not on site. And one thing with GBV, a lot of individuals do like going in person to receive service because, again, you're getting time away from a space where you're always either thinking of what your experience is by yourself with your own thoughts with no support, or you're thinking about it in the space where you're being abused. So being able to leave and get that in-person support is even post-pandemic that a lot of people don't have access to. It's virtual supports, which maybe for the service provider is convenient, but for the service user, which when you're doing client-centered work, a lot of that has to be remembered. And most likely within post-pandemic, doing those hybrid and remote forms of work, client-centered work was probably not first and foremost in majority of the organizations that were thinking of, okay, we're going to make this hybrid and remote. It wasn't thinking of, okay, the clients actually prefer the in-person.
Yes. For me, I want to talk about how the crisis for this COVID pandemic, how make vulnerable people, especially women living with HIV, to get medication, to go to do the checkup. Some, they don't have even a computer. They don't know how to use a Zoom. They don't have even a cell phone. And one thing just I wanted to talk about, aging people with HIV. Because of this situation for crisis of COVID-19, some, they have resistance now for treatment because there was not get services enough to do the checkup. People, they was want to check up every 3 months, go to see the family doctor, the specialist, to see how is he look like. People, because they stay in the house, they eat anything, so they develop diabetes. So many things around. So that is one thing just I want us to say. This also is psychologically, emotional abuse for this crisis. It become just a GBV violence because people, they cannot go out to do what they was doing. even in the organizations, some community center, you cannot go in there without have an appointment. If you even an appointment, they give you appointment maybe after 1 week, is it one person or for another. So that was very, very difficult. So to access services and the support, to be honest, with the survival of GBV, it was a very, very, very difficult at that time. Even now, people still behave that emotional abuse mentally. Yeah.
Most definitely the isolation and the lack of mobility, being trapped in where you were abused and not being able to move from there, whether it be that your work went online or for the first few months or weeks of the pandemic when everything closed down and works were figuring out how do we become pandemic friendly to reopen, just being able to stay home during those times. And one thing, I don't know if this was what they thought of worldwide, but specifically in Italy, pharmacies and grocery stores decided to stay open as well as open longer because they looked to serve as those new safe spaces. So that could have been something also individuals were using in Canada, because if you're trying to go to a grocery store and you weren't a frontline worker, which in itself gave you a privilege because you got a pass that allowed you to go in front of everybody in a line at a grocery store. So say you went to a Walmart, that line could wrap around the whole entire Walmart. And because you have that pass, you can go in front. But even for individuals listening that may have had that pass, think of all the individuals, women specifically, because that's what we're talking about today, and women identified individuals that you've seen in that line waiting for hours. And you are wondering, I could have never waited in that line. Remember that some of those individuals were waiting in that line because it was better than going back to where they were being abused. Even if it was going to take them 3 hours to get in that store. Yes. And it was cold outside. They rather have waited in the cold to get into a store, even if it was just to pick up milk or eggs or nothing. I remember seeing people in lines after the pandemic that said, I didn't even need to get anything. I just needed to be outside.
Needed a break from my reality. Yeah.
Yep. I just needed to be around other people. I needed to see other humans. So I think it's even that, thinking about what a privilege it is to be able to move around and not always have to think about your safety. And with that, thinking about how easy it is if you always feel safe to then step up and be an ally and speak up on topics around this, even if you don't know anybody that's going through it. And how Leslie shared before that, even though this video, yes, it may not get to a lot of individuals, or we're not going to be able to stop everything with this video, but say 100 people listen to this video, and then each of those 100 people, so we're speaking to everyone watching, each of those 100 people, so think about you listening to this right now as you as one of those 100 people. If you share that with another 10 people, that's now 1,000 people that have heard this. Those 10 share it with another 10, that's 10,000. And then if those 10 share another 10, we're at 100,000 people. So even within your circle of individuals that are your trusted friends, create ally groups to speak up or to just take up space around topics like this. Because from your circle of 10 is another 10, which is another 10, which could be another 100. If you shared this on one of your social medias and you have 100 followers or 200 followers and asked everyone to share with someone else, that's how we get gender-based violence to be talked about more. That's how we make this a conversation that is always happening, where now cultural and societal norms have no place, because we all know that this isn't something that just arises during crisis. This is a human rights violation.
Well said. Thank you. So the final question we have for you today, Chantal, is how can survivors advocate for themselves or seek help in the midst of a crisis?
For someone to be able to advocate for self, as a survivor versus is really acceptance. Acceptance, that is the key, like I said before, to move forward, and to seek services and support. Without acceptance, you cannot even able to ask help or support. I think also advocates as a survivor, they need also to have educations to be able to be strong, to be empowered from other women or service providers, or what we call resources, to learn, after learn, be able to move forward and then to know where to go, to ask services, to ask support, and the advocate. It's not everybody who can advocate for herself because of, like I said before, if some of the people have a stigma, self-stigma, they have these problems. Problem means to be able to go somewhere and then ask services or advocate for themselves because they don't want nobody to know about them. But for education and empower women, especially in this program for GBV. So, like I said before, is to create a safe space, health space, where people, they can share their experiences, what they go through. And then from there, they will get information and then be able to be strong enough, to be resilient, and then be able now to accept. Because ask services, advocate for yourself, you need to be strong. You need to accept. No matter what is happen, I'm going there. I'm going to ask services. Any circumstance, but I need to be alive. I need to have health. I need to have a care. So I think for me that is one thing just I want to say is to be strong, to be empowered, to have education, to be able to go there and ask services and advocate for yourself, because it's not everybody who can advocate for herself. Yeah, without education, without capacity building, capacity development skills also. So it is something like that.
Thank you, Chantal. I definitely hear the passion in your voice, and that's exactly what we need when we're having these conversations, just so the message can be relayed effectively. I do believe there's this saying that says you prepare for the rain before the flood comes, sort of. I hope I have it right. But I think it is important to equip yourself with the necessary tools and resources. If you're someone who is experiencing GBV, I think every opportunity you get, you should be trying to find out what resources are available. If there's a community workshop, sign up for it. If there's a friend, you try to confide in your friend. You try to find out where you're able to access services in the event, you need it obviously, but in the event it gets really bad and you have nowhere to go, or you don't know where to turn or where to look to. So it's very important to equip yourself with the necessary tools and resources, see what's available. In the midst of a crisis, survivors of GBV can advocate for themselves and seek help by utilizing available resources and building support networks. It is important for survivors to reach out to hotlines, online counseling services, or local organizations that offer confidential and remote support, such as crisis text helplines and apps designed to assist victims discreetly. Establishing a safety plan, which may include trusted friends, family members, colleagues, can provide emotional support and help with a safe exit strategy. In addition, leveraging social media and online platforms can help survivors raise awareness and connect with advocacy groups that may offer legal advice, shelter, or emergency assistance. Despite the barriers that crises often impose, seeking out alternative ways to access support, whether through technology or community resources, can empower survivors to advocate for their safety and well-being.
And with that, whether natural disasters, pandemics, or other emergencies, crisis can exacerbate existing vulnerabilities, leading to increased instances of GBV. Today, we explored the main forms of GBV, of trauma that often emerge or intensify during challenging times, and the critical need to shift the narrative around gender-based violence, from being viewed as an inevitable consequence of crisis to recognizing it as a preventable and addressable issue. It is vital that we advocate for proactive measures and interventions that can protect individuals during these vulnerable times. Unfortunately, disruptions in services during crisis can create significant barriers for those seeking help, making it especially difficult to develop resilient support systems that can withstand such challenges. And it is important that we're able to create those. And we establish the importance of empowering survivors to advocate for themselves, be aware of available resources, and to seek help in the way that is most safest for them. We hope today's conversation inspires you to think critically about the intersections of crisis and gender-based violence and encourage action in your communities to address these pressing issues, even if it's addressing it within your close circles. In our next episode, we will discuss how GBV in the context of LGBTQ communities are affected. And today, thank you for joining us, Chantel. And thank you, Leslie, for having this discussion that is so important. And we hope everyone is able to take something away that is listening from what we said. And like we shared, if there's 100 people and you just each share it with 10 people, we can reach a lot of people with this message and with this podcast.
Thank you so much, Chantal. Very engaging conversation. Thank you for all the points. Thank you, Ziana, for all the resources that were provided today. And thank you to our listeners. We hope we will have the ripple effect and this conversation will reach a lot of people.
Thank you. Thank you so much, Ziana. Thank you so much, Leslie. I appreciate to be the part of this dialogue, the conversation about GBV.